So, we may have just increased our anxiety symptoms by actively focusing on an anxiety provoking situation instead of avoiding it. Now, let's learn a new skill. One of the most effective coping strategies you can use for anxiety symptoms, particularly the physical ones, is to use deep breathing and relaxation techniques. Remember how we talked about the fight, flight, or freeze response? This response activates your sympathetic nervous system. It sends oxygen to your arms and legs so that you're prepared to fight or flee. However, less oxygen is sent to our thinking brain in our prefrontal cortex, which makes it difficult to think clearly. Deep breathing and relaxation activate the other part of your nervous system, the parasympathetic nervous system, which sends a signal to your brain to tell the anxious part that you're safe and don't need to use the fight, flight, or freeze response. Deep breathing gets more oxygen to the thinking brain. Also, by addressing the physical fight, flight, and freeze symptoms directly, you're freeing up mental energy to address other symptoms. Before we practice the deep breathing, let's take a moment to check in on our anxiety level. This is like taking a thermometer reading of anxiety. We're going to rate our anxiety on a scale of 1 to 10, 1 being very low or non-existent anxiety, and 10 being the most severe anxiety you've ever experienced. Please make a note of what your number is right now. Okay, so let's learn this new skill of deep breathing. I will explain it first, then guide you through it, and then provide some time for you to practice on your own. If you're in a comfortable place, you may want to lie down to feel the full effect. First, I will explain what we're going to do. Whether you are sitting or lying down, you will place one hand on your stomach and one on your chest. We want to feel the hand on our stomach move in and out more than the hand on our chest. We'll take a deep breath in through our nose. As we inhale, we count in our mind 1, 2, 3, 4. And we imagine using the air we breathe in to push against our hand on our stomach. Hold that breath for a count of 2. Then we exhale through our mouth like we're blowing out a candle. Exhale for a count of 1, 2, 3, 4, 5, 6, and pause before starting again. Please note here that the exhale is a little bit longer than the inhale. Now let's all try. Get comfortable in your chair, or if you'd like, you can lie on the floor. You may close your eyes if you feel comfortable doing so, or you may choose to keep them open. Now, I'd like you to breathe in, 2, 3, 4, hold it. Breathe out, 2, 3, 4, 5, 6. Breathe in, 2, 3, 4, hold it. Breathe out, 2, 3, 4, 5, 6. Now take a moment to practice on your own. I realize the breathing out through the mouth makes a little sound, but if you're feeling anxious about making that sound, I want to note that this is an opportunity to practice not avoiding. We're all going to sound a little funny at first. Okay, now let's take a new thermometer reading. Please rate your current level of anxiety on a scale from 1, very low or no anxiety, to 10, which is the most severe anxiety. Did you notice a shift in your numbers? I encourage you to keep practicing this simple yet powerful tool. This is something you can continue to practice anywhere, since it is a quiet practice and we always need to breathe.